Thanks for joining us today. Fatima, I know you're going to talk to us about a slightly different tack in terms of the carers agenda, yeah, I'll hand over to you now. Thank you.
Thanks, Lou. So yeah, fascinating to hear the conversation so far, and obviously as an exec director from a BAME background, this is an agenda very, very close to my heart. Just going through sort of the first slide and to give you a bit of context about what my role is in West Yorkshire and Harrogate. I'm the director for the Unpaid Carers programme, but I'm also the director for Personalised Care programmes and have a responsibility to support one of the system ambitions that we have in West Yorkshire and Harrogate's Health and Care Partnership, which is to make our leadership more reflective of our community. So we have a great number of sort of work streams and programmes taking place to particularly support that, because you can't really address, you know, decades or centuries of inequality with corrective action in a few sort of months. This will take time, it will take resource and commitment, so we're very much on message there. A little bit about my personal circumstances. So as somebody with lived experience of caring, I've actually taken an orthodox route into the health and care system. I've used my personal experience of caring as a force for change to really try and improve the outcomes for the 260,000 carers that we've got in West Yorkshire and Harrogate. But just going back to Samar and Aisha's conversation about, you know, the experience of being a BAME leader and the responsibility that privilege brings, that Sonia's just alluded to, I think it's really important as somebody from a BAME background that has a position and platform of influence and privilege to use that to the improvement of others as well. So it's very much about opening doors and creating opportunities for others. So with that in mind, if we could go to the first slide, please. Thanks very much. The one after that would be great. It'd be great to explore what we've been doing as a programme, and this has been more important now than ever. So when we first started talking about this in April, about how technology can be an enabler for carers, there is no way we could have recognised the potential and gravitas that we've now seen as a result of the impact of the COVID pandemic. Technology has truly been an enabler for many carers across this country. It's enabled us to be a bit more efficient about our caring. It's enabled us to think creatively about the mechanisms by which we utilise and how we access our health and care services, because actually there are alternatives and digital can really support us to explore what they are, and we can still support our loved ones accessing those health and care services in a way that is important to both of us, but really maximises the benefits and efficiencies for both parties. And also at certain points take the worry out of caring. So right now I'm caring for somebody that doesn't live with me anymore. They're living in their own place in a different part of the country, same region, but a bit of a distance. And sometimes that creates a lot of anxiety, and actually this can help both of us take the worry out of caring and give the carer as well as their loved one more independence. You know, there are many carers now taking on more care responsibilities, particularly those that are shielding to protect loved ones. COVID has really magnified some of the impacts of health inequalities as well, and the importance of accessible information and it being able to access information. So going back to the conversation of digital inclusion, we need to recognise that one size doesn't fit all, but really need to publicise and shout about the opportunities that technology brings. So if I could have the next slide, I'll talk you through what I mean by that. So first of all, you know, recognising that not everybody that is caring for a loved one lives in the same property. But when that does happen, it does bring additional anxiety and concerns. You know, we've got the practical things of making our appliances safe for our loved ones, enabling them to live independently while accessing heating and light. You know, the real positives that have been created by utilising, you know, voice controlled apps, for example, really create opportunity for carers and their loved ones to balance that real challenge that comes with caring, of keeping someone independent, keeping their dignity, but also keeping them safe, which, you know, for many of us is a very, very fine balance to maintain on a day-to-day basis. And obviously, like I've mentioned, as a distance carer, you do have that anxiety of who is coming in and out of the home of your loved one. You know, how do you keep them safe? And there are many ways in which we can do that. Obviously, many of us are very familiar with the potential of Ring. And I have that on my phone right now as we speak. So if someone is visiting my loved one, I can access that, see who it is and make sure that they remain safe. And also special phones as well. So for example, if you are somebody that isn't consistently able to access you know, phones or not familiar with smartphones, there are special provision available to make, you know, that connection and connection with people that is so crucial during this time possible for so many people. And I think also one of the key things that we've discovered during this journey is the ability to transfer some of that responsibility and power back to our loved ones. So, you know, there are things that we can do remotely, like making sure that people, you know, are moving around. For example, I'll talk you through what I mean by that, about personal alarms, about windows and sensors that enable us to care at a distance, maintain the well-being of our loved ones, but not really infringe on their personal liberties, which I think is a real important challenge. And then you've got the whole, you know, ability to now access healthcare virtually, which means that we can be part of the conversation. So while I'm at work, for example, I can facilitate supporting my loved one accessing healthcare but still go to work, which for many carers is a life-changing situation, and also really supporting the medicines management of our loved ones as well. So I think there's many different ways that we can explore this, and obviously really thinking about the impacts of COVID-19, for example. The access of being able to rehabilitate your loved one virtually is really, really crucial, and accessing services remotely online again is something that is enabling carers to be more involved if they wish to, but also do it remotely if that's necessary. So the next slide, please, and I'll talk you through what I mean by that. So, you know, just giving you some real first-hand examples of some of the things that we've seen, particularly in this region. We've heard from carers, for example, that have been looking after a loved one with MS and have had real concerns with supporting them with managing their blood pressure. Having that technology to keep track of their access to treatment, monitoring their blood pressure, has really enabled them to support their loved one to have their independence, but address the worries and anxieties that come with looking after a loved one, which I think is really, really important and empowering for both parties. And if you think about the other programme that I lead, which is Personalised Care, and really talking about what matters to the individual, really person-centred care, and making that, you know, applicable to people from different heritages, different backgrounds, different cultural connotations as well. The ability to personalise care to the individual need is crucial if we're wanting to address some of the health inequalities that are dominating the headlines as we speak. The other bit is about ensuring that when we're caring for somebody with dementia, which is what I did previously for over a decade, the ability to have sensor alerts or remote monitoring, particularly if you're not living in the same property, and many of us are distance carers, as I've mentioned, is crucial to, again, maintaining that independence, but also supporting that loved one to stay safe. And there was one story that I heard from a carer only last week about their mum, who they were living in the same property, and she kept waking up at 3 o'clock in the morning because in her head she felt like she needed to pack. It was just something to do with the dementia. And they couldn't stay up all night making sure that their mum was safe. They needed to sleep at some point, but the sensor alert enabled them to go to sleep, but have an alarm so when their mum woke up, they would have the alarm sensor going off and they could go and support their mum, which is a win-win situation for both, especially if you want to make sure that that loved one, you know, can contact you if they need you. Particularly when it comes to facilitating care and coordinating care across a number of family members. Often it falls to one individual, but it can be across, you know, a number of people at the same time. The Carers UK Jointly app is crucial to enabling us to coordinate care virtually, and it makes sure that whenever we need to go to work or balance the other responsibilities that comes with daily life, say work, or for me being a mum or being a wife on occasion, the Jointly app enables me to plan my care, plan my life, to enable that balance between caring and doing what else matters to in life, because we're not just carers, we're multi-dimensional people, aren't we? The additionality of sort of fall alarms and pendants, which are now being funded by many local authorities across the country, also enables not just carers, but actually people providing care services, home care providers, etc., to support people in a quite a transformational way. So you're again giving back the independence to the individual, but keeping them safe, which is crucial. And I think one of the key things that we've heard consistently across the country from carers from different ethnicities or diverse backgrounds is the fact that actually more and more of them are taking on emotional responsibility, more and more of them are taking on much more complex challenges, because they're not just dealing with the complexity of caring for a loved one, they're dealing with the emotional responsibility of dealing with, you know, people living through COVID, but also the emotional financial responsibilities as well. And some of them, their personal circumstances have changed directly as a result of the pandemic. So what support is available to them? What peer resilience is available to them? And one of the key things that I found really helpful, for those of you that know me from Twitter, is that virtual connection, that ability to connect with people, share ideas, share good practice, but get some emotional support, which is crucial to enabling us to continue to care. Because if carers are not able to continue to do that, we're not going to be in a position as a health and care system to be sustainable, because actually what will happen is both the loved one and the carer will require that health and care intervention. And as we know over the increasing headlines in recent days, our health and care system is a finite resource, and we therefore need to support people to continue to care as much as possible. What we'll also say, which is I think really, really important, is we've invested with Carers UK in a number of ways to support people that are balancing work and caring, which I'll come to in a moment. Sorry. If I could have the next slide, please. So, you know, we're in a whole new world, particularly since March, April time. And what we've tried to do is really roll with the punches and go at it with a glass half full approach of seeing the opportunities of ways in which we can innovatively support not only carers but other stakeholders that are being supported by the programmes that I lead. So, for example, in Personalised Care, we are very much focused on supporting people with learning disabilities, for example, to amplify their voice and really address some of the concerns that we saw in the headlines a few months ago about the value of people with learning disabilities, about their contributions to their health and care relationships, and actually how much they're heard in the decisions being made about their care. One of the key things that we've done is an investment in the Brain in Hand application, which for some of you, if you don't know what it is an app that enables people to make decisions, manage anxiety and deal with unexpected situations, particularly, you know, if you're connected remotely. And this has been particularly great for people with learning disabilities, but also, you know, people that are living with mental health conditions as well, which, as you probably appreciate, is crucial right now. The other area that we've really significantly invested is the app called My COPD. So if you haven't seen it already, Google it, but it very much says what's on the packet, which is, you know, supporting people with COPD and long-term condition symptoms of that. And it has things like, you know, online tutorials and videos, as well as accessing rehab to really, again, give the power back to the person with a long-term condition to take ownership of their own health. And what we've seen from the impact of COVID-19 is that there is more awareness about how the fact that our health is our wealth, but also that actually people are now focused on their health and well-being and how healthy they are. So me being kind of Machiavellian, I guess, saw this as an opportunity to actually, well, let's build on that. Let's give people the skills, the expertise, their knowledge to manage their own health and well-being. So in essence, that's what carers and the public have told me that they want. And, you know, it's in my gift to give it to them. And if we do it in the right way and we empower people in a way that is meaningful to them and in a way that matters to them, it will address some of the health inequalities that we've seen when it comes to accessing services, because we're doing it in a meaningful way with a range of opportunities that the patient can then decide what works for them, or for me, the person. I don't even think calling them a patient works these days. So in addition to that, one of the key areas that has been a passion for me is young carers. We've got young carers as young as 4 in West Yorkshire and Harrogate providing care and support to a loved one. As a parent myself to 2 young children, this is not something I would want my children to experience, but sometimes circumstances, you know, needs must. So one of the key things we heard from young carers during this pandemic was the fact that they wanted to access support virtually, anonymously sometimes because of the stigma that sometimes comes with caring, and also find things that are meaningful to them. So we're in the development of an app. It's one of the first in the country specifically targeting young carers. It's hoping to go live just before Christmas, and it'll have a range of resources on there co-designed by our young carers. We have a steering group that has access to groups across the country that enables us to co-produce this stuff with our young carers, and I'm hoping that once it goes live you will support that and share that with your networks. Another key area for me, as someone that is a patient public carer involvement champion, is enabling that peer-to-peer influence. So I am someone who will listen to people that I can connect with, who look like me, who resonate with me, that I have some commonality with. I think it's really important that we have people like that championing the digital agenda. So we can't just have the same usual suspects talking about the importance of digital, because if you can't resonate with them, they're not going to hear your message. So what we've been doing, particularly with the Personalised Care programme, is really championing the importance of digital champions from a whole range of diverse backgrounds, articulating the importance of what digital can add and how it can make life, you know, a little bit easier, a little bit, you know, more useful, and help us with our day-to-day living. And therefore that we've found that's been really, really crucial. And also supporting digital training within communities, because what we found is it doesn't just help with caring, doesn't just help with digital you know, access to health and care services. It's a life skill, and we need to empower people in this new world to be able to access digital information, training, YouTube, WhatsApp. And, you know, I've seen many Auntie G's, relatives from my South Asian heritage being able to use WhatsApp and calling people abroad and watching YouTube videos and accessing dramas and stuff on their smartphone. If they can do that, then why can't we utilise those same platforms for the health and care messages we're trying to get to certain communities, particularly when it comes to diabetes or other long-term conditions, say cancer, that are really impacting our groups disproportionately. The final two things that I just wanted to say was, you know, it's really important that we try and share health and wellbeing resources as much as possible. So one of the things that we've got on our West Yorkshire and Harrogate Health and Care Partnership website is a specific section dedicated to carers, dedicated to health and wellbeing resources, and within that is some information for our working carers, so how to balance health and care, and also some specific information and materials for carers. So for example, what to do if you start a caring journey, what information and tools do you need to manage those, navigating, you know, health and care systems, which is really, really challenging, but also how to take care of yourself, which is equally just as important. And on the note of the digital resources, we've actually invested, which has been adopted nationally now, on some resources from Employers for Carers, which is an arm body of Carers UK. They have lots of resources on how to support organisations who are employing people that are balancing working and caring responsibilities. So just to give you one quick statistic, for example, 1 in 5 prior to COVID of our NHS staff were balancing work and care responsibilities. So that's 20% of your staff right now. During COVID, that has now increased to 1 in 4 of the general population. So if you think roughly 25% of your workforce is balancing work and care responsibilities, the importance of having those materials about how to manage them effectively is crucial. But what we've also developed is a digital working carers passport, which has been adopted nationally by NHS England. It's available on the electronic staff record, and it's a really important tool to help us as employers, as leaders, as managers, to support the people that are balancing working and caring like me, because I can assure you we're very tired at the moment. The final thing I will say is the importance of sharing care records as well. So one of the key things that we found is really important. One is care awareness, and the digital platforms to really heighten their contribution to society is important. But the other bit is about how do we make sure that they're connected to their loved ones, so that their expertise and knowledge on that loved one is included in the decisions being made about their care. Lycra is a brilliant example of that. We've also been doing some great stuff in Leeds about digital inclusion and supporting people with dementia, which you may have seen on Twitter in the last day or so. And then if we could just have the final slide, just to leave you on a sort of positive note about what the future holds. The future is positive and bright, on the condition that many more of us adopt and see the potential that digital innovation has, not just in regards to our workforce or our members of the public accessing services, but our partners in care, our unpaid carers. And in ways, you know, of sharing information about real-time updates, if we really want to use the skill set that carers bring to the caring relationship, then it's important to share information in real time and really support people with virtual training and development. But my final message to you all is that knowledge is power. And if we really want to create meaningful change, if we really want to empower both the public and our carers to take ownership of their health and well-being and really make the best use of the finite resource that is health and care, then we need to give the power back to people. So that will be my final message. And thank you so much for listening.
Well, thank you, Fatima. That was a really great insight, and I think many of us probably don't appreciate the kind of role and the impact of carers that COVID has had. So yeah, bravo, amazing work. Thank you for sharing that.